Welcome to the Paediatric Emergency Department at Children's Hospital London Health Sciences Centre in London, Ontario. I'm Dr. Iman Lubani, one of the pediatric emergency physicians here at Children's Hospital. I'm also the undergraduate medical education director for the Paediatric Emergency Department. So I'll be the person that you talk to if you need any help and have any questions. So let's get started with your orientation to the Paediatric Emergency Department. Before you start your rotation, you should be able to obtain an identification card, an ID card, through security. This will help you get into the emergency department and get around. You should also obtain a pair of scrubs, whether your own or one through LHSC. And you should also have access to and training on FirstNet, which is the patient information system that we use here in the emergency department. Now that you've got all of that ready, let's get started and show you around the emergency department. When you start your rotation, when you start your day, you're going to be coming into the staff area and introducing yourself to the staff physicians sitting at these computers here. These two computers in the front are the staff physician computers. This computer right here is our fellow computer. And then this computer right here is one of our resident computers, reserved for residents or senior residents. This computer bank right here is for medical students and residents as well. So you'll be choosing a computer, logging in, and getting started. So first, we're going to start in Pod 1 of the Pediatric Emergency Department at the nursing station. Pod 1 consists of beds A through to F. Then we'll move on to Pod 2 that consists of beds G through to J, as well as privates 1 through to 4. And here is the Pod 2 nurses station. And then walking down the hall, this is our cast cart that we use for casting. We're now going to move on to the resuscitation or trauma room, where we resuscitate acutely ill patients in the Pediatric Emergency Department. Now moving down the hallway towards our isolation room, which is our only negative pressure room in the Pediatric Emergency Department, used for patients with communicable illnesses. And then our ambulatory care area, that's for ambulatory patients and consists of beds 1 through 5. So now that you've been oriented to the physical layout of the Pediatric Emergency Department, you're ready to get started. You'll be going to see the patient, and you'll be starting with your history and physical, and then of course finding an emergency physician who's free to review. When you review your patient, make sure to present the history, the relevant history. And then when you reach the physical examination section, make sure that you start with the overall impression you've had of this child, as well as the vitals, and then your interpretation of those vitals. So for example, little Mohammed appeared well. He was running around the room. He was non-toxic. He was pink. His vitals were X, Y, and Z, and these are normal or abnormal for his age based on your interpretation. And then you can start with the remainder of your physical exam. Once you've presented the physical exam, now you will present your differential diagnosis for this patient, which should include at least 3 possible diagnoses for the problem or the presenting complaint. This is very important, so this is something you're going to be working on prior to presenting to the staff physician. And then you will also be presenting a management plan, including investigations and possible disposition of the patient. On a very busy shift, you may not be able to present all of that because it may take too much time or the physician may be in a hurry, but it's important for you to do it anyway because it's an important exercise that will really help you develop your skills and hone your skills. Now that you've gotten all of that, you're ready to work in the emergency department. Should you have any concerns or worries, you can contact me, Dr. Iman Lubani, or you can contact Ms. Vanessa Jones, who is the administrative pediatric clerkship coordinator. Best of luck and see you in the emergency department.